Hi there, I'm Dr. Kristina Tansavatdi, and I'm a double board certified facial plastic surgeon. In this video, I'll be answering a question I get from patients who are not ready to pursue surgery yet, and that is how to slow down the aging process so that they can be prepared for doing surgery a little bit later down the road. So how do you do that? What are the things that are available that you can do to slow down the aging process if you don't have surgery? Well, there's a couple of things in the bag that I like to talk to you about today. And number one is very simple, straightforward. People just gloss over it, but that is the importance of sleep. Sleep is how our body repairs. And the common theme here all today in this video is going to be talking about aging process related to inflammation, DNA damage, and how you can slow down that DNA damage. And that one of them is sleep. Because let's face it, a majority of Americans do not get enough sleep. A majority of Americans' average is about 6 hours a night. I'm guilty of it too. So that being said, really need to push for at least 7 hours and ideally 8 hours a night. I know you're gonna say, I don't have enough time to fit in 8 hours. Well, it's really a must because you can't go backwards. People think you can try to catch up on the weekends. It's truly not the case because when we sleep, our body clears out the toxins and it allows your brain to function at its maximum. So that being said, DNA damage gets also repaired during our sleep. It's like taking out the trash, clearing out the debris. So that is important. Number one is sleep. This is why I'm spending so much time on it. Number two has to deal with diet. What we put in our body, what we feed the cells in our body is also going to create either damage, DNA damage, or it's going to help it to repair. So that is good amount of vegetables, fibers, yes, all these things that you already know, and less of bad fats and sugar. Most important is sugar. Carbohydrates, simple carbohydrates are things we really need to eliminate from our diet. Besides eliminating or reducing the amount of simple carbohydrates in our diet, the other thing you could be doing is to reduce the amount of calorie intake you have in a day. So of a lot of the studies that have been done on mice and other animals, they've shown increased longevity, and really that has shown in multiple studies, and that is about caloric restriction. You can restrict the amount of calories you take in a day either by doing some intermittent fasting, which means that you take longer periods of time where you don't eat, let's say from 7 o'clock at night till about 10 in the morning the next day. Yes, skipping breakfast. Or you could do the reverse and skip dinner. I don't know about you, but I actually like dinner, so I choose to push my breakfast till later in the morning. And the third thing that I recommend for slowing down the aging process is to focus on exercise. Yes, exercise. I said exercise. That's a simple answer, but it is. Exercising at least 150 minutes a week has been shown to improve our longevity, and that means it does not have to be strenuous. It means getting moving. So even if you're just walking for 150 minutes a week, that will be helpful. When those studies were done, we looked at zone 2 level exercise. What is zone 2? It means you're working out at a level where you are able to talk, but it takes a little bit of a struggle to talk while you're working out. So you're huffing and puffing between words, and that's the right level for zone 2. 150 minutes a week is the limit as where you can see improvements in longevity. That's how we slow down the aging process. And what does exercise do? Why does it do that? It's because it helps your body to move out the toxins, improves blood flow, improves circulation, and that's how you remove inflammation in your body to allow the car to run better. So that's the third tip. The fourth tip has to do with something I do here in my office, and that is Botox. Yes, a neurotoxin. It sounds bad, we're putting a toxin in the body, but if you've seen some of my other videos, how Botox works is that it minimizes the motion of the muscles that are causing the repetitive wrinkles in our face. And that's how you can slow down the need to pursue surgery down the line to slow down the aging process or reverse the aging process. But Botox will slow down the aging process to prevent you from coming to see me too soon. Next tip I have for you, or the last one, would be good medical grade skincare. Yes, good medical grade skincare involves use of a good sunscreen, good retinol or retinoid product, or retin A product, which will help to slough the dead layer of skin cells on the surface, as well as stimulate collagen and reverse DNA damage that is affecting the sunspots that we see on our face. And a good vitamin C would be the last one in your good medical grade skincare to help with pigmentation in the skin. So 5 tips again. Number 1 has to do with sleep. Number 2 has to do with diet. 3rd is exercise. 4th is Botox. And 5th is good medical grade skincare. So there you have it. If you're not ready for surgery, how do you slow down the aging process? For more information, please tune in to our YouTube channel at Faces by DRT1 or our social media channels at Faces by DRT. Thank you.